In this video, I'm going to explain what ACL Prehab is, what it looks like, and how it's translated into practice. If you've recently torn your ACL, waiting for surgery, or even just considering your options, you may have heard of the term ACL Prehabilitation or ACL Prehab. ACL Prehab is a structured physiotherapy program designed to improve your knee mobility, strength, and function prior to your surgery. It's not about doing anything extreme or pushing through the pain. It's about getting your knee in the best possible state prior to your ACL reconstruction. After ACL injury, pain, swelling, and weakness are common and can affect knee function. Prehab helps address these issues early by improving knee mobility, strength, reducing swelling, optimizing control, and therefore overall function. ACL Prehabilitation consists of several key pillars which are designed to improve patient function. The first pillar is terminal extension. Terminal extension is the ability to get the knee completely straight, and it is a key predictor of post-surgical success. I'm now going to show you how to perform the terminal extension exercise. So you can do this either sitting up or down. Ask the patient to straighten their leg and imagine pushing the back of their leg into the bed. The knee should be as straight as possible. It should not be painful, and you should not feel any strain in the front of the knee. You want to activate this muscle here and hold for 5 to 10 seconds at a time. The next pillar is functional knee flexion. The ability to bend the knee comfortably is linked to daily activities which are important to us, such as getting up and down from a chair, going downstairs, and going from sitting to standing. In order to perform the functional knee flexion, you can sit up or do this exercise lying down. What you're going to do is try and bring your heel towards you, sliding up. Like this. You can wear a sock or use a towel to ease sliding, coming down nice and controlled. Once again, this exercise may be limited or slightly uncomfortable due to swelling, but make sure you go to your comfortable range and not force the end of range movement. After ACL injury, due to pain, swelling, and weakness, the muscles in the front of our thighs, our quads, become weak. Another key pillar is quads activation. This is activating the muscles of the thigh, particularly a muscle on the inside called the vastus medialis oblique, or VMO muscles, to promote early strengthening prior to surgery and boost post-operative goals. In order to perform this exercise, you're going to contract the muscle at the front of the thigh called the quadriceps. To do this, you want to push your knee into the bed and feel this muscle tensing on. To aid, you can use your hand to give yourself a little bit of feedback and try to hold this for 1 to 5 seconds. And relax. Good, and try one more time for me. Good, so you should feel these muscles contracting, especially the muscle on the inside, this VMO which we discussed earlier. The next pillar is swelling and effusion management. After knee injury, the knee can become swollen, stiff, and painful. This can not only cause discomfort, it can also delay surgery, as this is something that is important to improve prior to your ACL reconstruction. Elevation can be effectively performed by placing the limb in an elevated position using pillows like so. Swelling can also be managed through compressing the area and also using ice. The final pillar is psychological readiness or preparation. Upon finding that you have an ACL injury, you may not be mentally prepared for surgery. You may have a lot of questions, or you may feel uncertainty around your post-surgical outcomes. Psychological readiness is about preparing you for surgery, answering any questions you have, any concerns, and also understanding your goals and what they might be post-surgery. ACL Prehabilitation isn't about delaying your surgery. It's about getting you in the best mental and physical state. You can pause or rewind this video at any point to review the exercises which we discussed in this video. Good luck with your prehab, and feel free to send us an email or contact us at any time if you have any questions.